Welcome to the World Extreme Medicine podcast. I'm Dr. Will Duffin. As a global community of health professionals, we're all fascinated to learn how healthcare provision has been impacted by the pandemic in different health systems. And in previous episodes, we've met frontline clinicians from different corners of the globe. We met Luca Corenzo, an intensivist working in Milan, and of course, Emily Farkas, a cardiothoracic surgeon based in New York City. And in this installment, we'll be transporting you to the Republic of the Philippines. This is an archipelago of over 7,000 islands in the Western Pacific with a population approaching 120 million people. It's an industrialized, developing nation, an economy that's transitioning from agriculture towards services and manufacturing. Filipino is the recognized national language. However, there are hundreds of different dialects. Many of you will know the Philippines for its spectacular diving, or maybe world champion boxer Manny Pacquiao. And of course, it's a hotbed of musical talent and beauty. Everybody sings, and it has no fewer than 4 Miss Universe winners in the last 5 years. However, like all corners of the globe, it hasn't escaped the horrors of the COVID-19 pandemic, and now has over 450,000 confirmed cases, with a death toll exceeding 8,700. And today, I have the great pleasure of welcoming Dr. Patricia Gatbonton to the podcast. She's a 57-year-old internist and endocrinologist and former editor-in-chief of the Manila Times Publication, HealthNews. She runs a private practice out of a small 300-bedded private hospital, and she's been doing this for the past 25 years, seeing around 12 to 15 patients a day in a combination of ward work and clinics. Tish, it's a great pleasure to have you on the show. Welcome.
Hello. Hi, Will. Mabuhay from Manila. Mabuhay in our language means long life and live well. So it's kind of our live well and prosper. So mabuhay to everyone on the podcast. And it's a great pleasure to join you this evening. It's evening already, nearly evening in Manila. We're about GMT plus 8 at the moment, I think.
Yeah.
So it's my great pleasure to join you. Thank you for asking.
Mabuhay to you too, Trish. And you've just finished work. I see you're in some very fetching scrubs.
Thank you.
And I understand you've met Manny Pacquiao at an airport.
Yeah.
Tell me about that.
Yes, I have. Actually, he's our boxing champion. We call him the Pambansang Kamao. So like the country's this is his like fist, right? So he's our like country's fist. And we're very proud to have Manny as a world-class boxer. I was flying in from JFK to Manila in one trip, and I didn't realize that he had gone to New York to receive some kind of an award from some magazine, some sort of I'm not sure if it was a SP award or some kind of award from a magazine. And he was on plane, and he was in business class. I was in the upper level, he was on the bottom level. And so when we found out he was on the plane, we said, well, how are we going to be able to manage this? Because we didn't want to make it embarrassing for him. So we went into the lounge, because he was at the lounge, and we said he can't escape us in the lounge. So we were all doctors. There was about maybe 10 of us traveling together. And I met his wife in the toilet. I went up to her and I said, hey, do you mind? Because we're a group of doctors, we'd love to have a photograph with you and your husband. Would that be possible? And he was really actually sitting just quietly in a corner reading hardcover. I don't know. I think it was some kind of a hardcover book. And, she said, oh, yes, of course, certainly. And so she, and I sort of went out and I got the people together. Hey, guys, we're going to have an opportunity to have a photo op. And so she went up and he just looked up and he said, oh, and he said, oh, how nice. You're all doctors? And he had a little conversation with us. And so he agreed to have a photo. We didn't want to abuse his kindness in having one photograph with everybody. So we did a group photo, made sure that I was standing right next to him. Then I cropped everybody else out of the photo. And then, so that photo that I have with him, taken at an airport at Narita, actually in Japan, is something that I take out every time he has a game. I kind of do it good luck for him. So I post it, and everybody, when there's a game, when he's fighting, everybody's indoors. There's nobody. It's usually on a Sunday in the Philippines. Everybody's indoors. The crime rate drops. Even the robbers and thieves and everybody bad, people who have bad, stay at home and watch Manny Pacquiao. So
Everything just comes to a standstill. Everyone
yeah,
just
yes,
pauses and they tune in,
exactly,
and
exactly. So
great.
he's the one who is able to, like, bring the Philippines to a halt. And so I think it
Yeah,
was a British boxer that he knocked down in the second round.
yeah,
So that was one of the most amazing fight in history, because it only lasted less than 6 minutes.
yes, yes.
He knocked somebody out, right? So we are well known for Manny, but we're also well known for, as you mentioned, beauty and also singing. I
Yes.
was saying, if anybody went to a hotel or a lounge or something in a especially in the Middle East or even in Europe,
Mm.
and you hear a really, really good band, ask them. 90% of the time, they would be a Filipino band, because
Yeah,
we export a lot of nutrition. We export a lot of. Oh, I have to say, one of our biggest exports to the UK is actually nurses,
yeah,
and not
that's
only in
true.
the UK but also in the US. The
Mm.
highest number of deaths, apparently, in a racial or identity or nationality, are actually Filipinos. I
Mm.
heard that the other day from on a CNN report, and
Mm.
I didn't realize that even in the US and in the UK, apparently the majority of deaths are from Filipino nurses, because there's so
Mm.
many of them. So that's
Yes.
one of the biggest impacts, I think, that we share
Yeah.
in the Philippines and the UK,
Well,
is our
it's a huge
nurses.
problem, I
Yeah.
think, in the UK with the death rates. Is Black and ethnic minority health workers and general population are disproportionately affected by COVID. They appear to be more
Yes.
vulnerable to more severe disease, and it's something we just haven't been able to
Yeah.
solve. So
I don't
moving on
know,
to yeah.
but what's strange, Will, is that
Mm.
there are protocols for, there's recommended protocols to. I mean, that protocols have changed, so many times already, and
Mm.
there's updates coming through our society. It's called the Philippine Society of Infectious Diseases, and
Mm.
so they keep putting out our guidelines. They change the guidelines rapidly every time there's new evidence, and so
Mm. Yeah.
so we get, they do cascade it, and then we try to all follow the guidelines, and so follow it shouldn't be. If we follow the guidelines, then I maybe that's the reason why our death rate is actually not so bad. I
Yeah, so
mean,
talking about death rates, Tish, tell
mm,
us, give us a flavour of what things have been like for you in the
okay,
Philippines in healthcare over the
right,
last since March, when this pandemic
okay.
broke.
Well, actually, it started, apparently, the first case was recorded in the Philippines sometime mid-February. It was a person who came from Wuhan, who had traveled to the Philippines. They traveled directly from Wuhan to the south of the Philippines, where this beautiful beach called Boracay. I don't
Mm.
know if you've heard of Boracay, but it's world famous. And we also have these islands that are also world famous called Palawan. It's been voted the top best island in the world by Condé Nast for the last, I think, 5 or 6 years. And so they come direct. They come as tourists. And the first person who was recorded to have COVID in the country was a Chinese national and his partner, who had come in from Wuhan. And when they came out, we'd already heard about it coming in. And what they did, one of the first things they did was to ban flights into Manila from Wuhan. And then after that started, they were talking about an extreme lockdown immediately. So within a month of the number of cases rising, we were like in our 2000s, something like that. We're at 400, and we're at how many thousand? 452,000 as of yesterday. It was just about 2,000. They decided, the government and the Department of Health, and there's a task force called the Interagency Task Force for COVID. So it's representatives of different government, public, private, and also army, stuff like that. And there's a whole task force, and then the president also sits on the task force. They decided that we needed to undergo extreme lockdown, so quarantine, extended community quarantine. So it's called ECQ. So under ECQ, people weren't allowed to go to work. Malls were shut. Everything was pretty much shut. My parents are both 94 and 82. My mom hasn't, honestly, my mom hasn't left the house since March. My dad hasn't left the house since earlier than that. And then I'm you're only allowed to leave the house in an, if you had to go to get healthcare, or if you had to get essential services like groceries, and markets, and they had to limit access, and there were lines, and then there was distancing, and then they've mandated mask wearing ever since the beginning of the lockdown. They had checkpoints. They had actually army checkpoints in different areas, and one time I got stopped. um, there was a queue, but then they had several different lanes with soldiers. And then what you need to do is either, that's why we're wearing these now. We didn't I didn't used to wear scrubs it every day, but every time we go to work now, it was just easier, because one, it's easier to identify you as a healthcare worker. And so nurses and doctors started wearing their scrubs to work as well. And then you have to show them an ID, some kind of evidence that you're a healthcare worker. And I just tended to drive with my stethoscope around my neck. And so, they just kind of wave you on, and then they let you go to the hospital. So it was an extreme lockdown for 3 months, from March 15th to June, the end of June. And even until now, schools are not yet back. My nephew, who's in college, started school, but he's still just doing it online. It's online education, and none of the schools have gone back ever since March. Um,
It's
People who are
very,
at the moment 65 and above are not allowed to leave the house still, all right? And 18 unders, so even children or teenagers are also not allowed to leave the house. And they encourage working from home now. But what happened was, when the pandemic happened, um, there was not only the extreme lockdown, but difficulty, because people started, you know it affected economics. But the thing is, we didn't people would grumble and complain. But what's different, I think, for us, is that the countrymen were more my countrymen are more cooperative and compliant um, with the government regulations. We didn't, what we've noticed is that, compared to what I'm seeing, I've been following the US, through the New York Times, as well as you with the Guardian and Daily Mirror. Um, I've been looking at what they're putting in the headlines, and you're seeing people going out, and then not wearing masks. But in Asia, we've had outbreaks of, we've had SARS before, and we've had MERS-CoV, and we didn't have an extreme case, because government mandated mask wearing. This is the first time it's happened in the Philippines, but in Hong Kong and Korea and Japan, they had mask wearing even earlier. And so Asians are more used to, I think, wearing masks, and so it's not unusual. It's almost a fashion statement in Japan, actually. But in the Philippines, when they said that you needed to wear masks, what they did was, private corporations bought, they ordered from China and from neighboring countries, because there was a run on masks, surgical supplies, and gloves and stuff like that. People panicked and started to hoard. So what they did was, large corporations actually bought and then started distributing. And then you had church groups who were distributing to those who couldn't afford to have masks. And so they tried to manage the shortage. Government also started distributing. So, and the majority of the people started donating mask, PPE, and our hospital, our small internal medicine department received so many donations, food, um, just support, so much support, PPEs, masks, uh, things that we needed. And so that support from the community, as well as private individuals, was quite overwhelming. And so we were very grateful for all the help that we needed. What happened was, nobody was allowed to do medical arts. You weren't All the surgeries, all the outpatient, all the elective procedures were stopped, and everybody just concentrated on COVID. So what happened was, when they said we couldn't go to work, by the 18th, a group of us in the hospital already formed a volunteer team to go on duty alongside our frontliners, because our frontliners are just our medical residents, and we didn't want them overwhelmed or also overtired, and we wanted also to show our support for them. So there was a group of us ranging from senior. I'm in the top end of that range, but I did have somebody who was 62, who was also our chairman, who tried to help as well. And so there was a bunch of us trying to unload the ER by seeing all the outpatient consultations that overwhelmed the emergency room. Everybody who thought they might have a scratchy throat or a sore throat or thought they might have COVID, they were turfed to us. And so we actually went on duty for the first 3 months to help out, to reduce the load for our frontliners. So basically, that's what pretty much almost every hospital did. They had a team who felt willing, and it wasn't mandate. We didn't have to. We weren't required to, but we came up with a team of people who had less risk. You know, we didn't want our olders people who had diabetes or hypertension, or whoever had a risk factor. We eliminated them from the team. We said, no, I think, we'll take care of it. And then what we did was, every person who paid us, we didn't accept the money. What we did was we put it toward a common fund, and it became the fund to supplement whatever we needed to buy that the administration wasn't providing, that we thought we needed more of, or wasn't donated to us. And eventually that fund where we people had donated money to, we actually just gave it out the other day as the Christmas bonus, to add to the Christmas bonus of the resident staff. And so that's what happened. We had to pitch in. And at the height of the COVID crisis, we kind of had two peaks. The first was sort of in April and May. And then the second one was August and September, where we had a whole bunch of people coming in. We had to turn people away. We couldn't accept, and we had to start sending them to National COVID Center. The Philippine General Hospital, which is the major government-run hospital in the Philippines, the biggest one. It's the one that accepts charity patients as well as paying patients. It became the entire hospital was converted to a COVID hospital. So they identified several COVID hospitals in the metro area, and Metro Cebu and Metro Davao, which is the major cities in different island groups. And they identified major centers there, so that people who couldn't afford a private care in terms of their COVID had to be brought into those centers and to cope. We had to turn people away at some point because we couldn't keep them. We couldn't keep them in an emergency room. We couldn't put them in a room, because the average length of stay for a COVID patient was about 2 to 3 weeks. And before you could release them, you had to have 2 negative tests. And so it really took a long time. And so the beds were occupied for a long time. And so for each patient, you only have a limited number of beds. So there was a crisis earlier on where we almost ran out of beds. So it's been tough. The other difference between us and you guys is you guys have a national health service where the healthcare is actually subsidized. In the Philippines, majority of the payment is out of pocket. We do have about 50% of healthcare in the hospital is health maintenance organizations, or what they call HMOs, right? But 50% of the population has to pay out of pocket. And then the government insurance system, although they passed a law just about late last year, early this year, for universal healthcare, similar to your NHS, they're still ironing out the implementing rules and regulations, and it's not going to come to reality until about 2 or 3 years from now. And they're still trying to find the money to where it's going to come from, et cetera, et cetera. And so the implementation of that is going to take a while. But so the burden is really heavy on the Philippines. And so it's in our best interest to keep the numbers as low as possible, because honestly, we would have a higher death rate if it got really, really bad, because people just couldn't afford it.
Yeah, Tish, it's very interesting hearing that. Many of those have parallels to certainly our experience in the UK. You describe all the camaraderie at the early start of the pandemic and the outpouring of support and from the public, particularly towards health workers.
You guys had I remember you guys had a clap for carers.
We got clap for carers.
You know what they did for us? They would bring a fire ambulance, an engine, and they would spray water, and then they would sign they didn't do a clap for carers. What they did is they drove around to different hospitals. They had like a parade, and they had like, I don't know how many fire trucks, and then they would park in front of your hospital. And then they would spray, they would come out, and then they would sound their what
The
do you call
siren.
that? Yeah, the siren.
Yeah.
And then they would spray water on the hot. I don't know if it was like a blessing or something, but
Right.
definitely that was their way of saying thank you.
So
And it
keep the
wasn't.
windows closed, otherwise you'll get a fire hose through the.
Yeah. No, actually, of course, it was closed. But the thing is, we would come out, and then they'd be saluting you road and drive through with the fire engines, and so
Yeah.
that's how they did. We didn't have the clap for carers, but we
Great. I
did
love
have
that.
the drive through fire engine parade.
I love how appreciation is shown in
Yeah,
different ways across the
different
world.
ways.
It has unique
Absolutely.
kind of cultural stamp wherever you are. So the other thing
Yes.
was interesting that you also experienced lockdown. I think almost every country in the world has had some form of lockdown to control the
Yes.
outbreak. But interesting, in the Philippines, that's been perhaps a more militaristic version. You say you've had the army has been deployed
Yes.
with
Yes.
checkpoints. Yeah, that is a huge difference from the
Mm,
UK, where we haven't seen the
yes.
army's been very much in the background. We
Yeah.
certainly haven't had a military presence throughout any of it. What is that something that you're
Yeah.
habituated to in the Philippines, or was that quite new?
Well,
Was that quite shocking?
no, it's not shocking because well, in our past we've had several coup attempts before, and this was in the during the time of we've had three EDSA revolutions already, right? So every time we had a EDSA revolution, we'd have army in the streets and tanks and stuff. So actually it's not so much of a shock, but the army was all only to ensure that um it's more of ensuring rather than luck. There were fines, supposed to be fines if you're caught out and you're not supposed to be on the road and stuff. But definitely, the army checkpoints were just, it wasn't. It's not. It's not. It's not. We don't have a. It wasn't a concept of, oh, I'm scared the army's on the road. No, it's more of they're going to ensure compliance. They're each neighborhood, even our neighborhood, I live in a sort of gated, semi-gated community where we closed all the gates and the access was only one entrance and one exit. And you had to either have a sticker or some kind of thing so you can come in and so come go out, and so they know where you come from, and then they take your temperature. So people, each community sort of had to, or what they call barangay. We have little political units called barangays, and they take care of their own area. So, for example, if you live in Bristol, and so if there's a small, like, Bristol takes care of itself, and it can impose pretty much how it wants to set this up. So you have a little bit of independence, but again, we do have an overall task force where the president is the head of the task force, and he has some generals, then he has the Department of Health secretary, and then he has some intergovernment agencies, the Department of the people who take care of distributing relief and all of that. So they have all of that in board, and they meet regularly, and then they have an update every week uh, on national television. And then you have and then there's a Viber group from the DOH that sends out the data every day, and if you subscribe to that group, you can get the most recent thing. So for us, the army isn't, having the army on the street at the time wasn't. We had a curfew. There was an 8 p.m. curfew at the lockdown, and then it became 10 p.m. In June. And there's still a curfew now. We're still under curfew after 10 p.m.
Was there much resistance to that, Tish, or was that something that people were able to accept?
Actually, people, there wasn't a lot of. I mean, of course, you say, "Oh no, why do we have to do this?" But it's just a matter, I think, of understanding why it has to be done, and the message, being said to you. Now, listen, we need to do this because uh, you have to comply because you want to protect not only yourself but your family members, and so people were encouraged to work from home. We locked down, as I said. People are allowed to go out. Even my parents haven't gone out since March, and then it's, of course, it's hard to get when you're in a small house, and for example, you're living in a lower income neighborhood where people are crowded in a house. It's difficult, and it's easy to understand why it can't be done, or it's difficult to do, that they can isolate within amongst themselves. But generally, the compliance and understanding for why it needs to be done is there. Of course, all the collaterals, like, my brother and his daughter lost their jobs. Um, a friend of mine closed her restaurant. So there was economic. There's economic collateral, yes. And as hard as as it is to accept it, the bottom line is, as long as you understand that health is the most important, you don't want people to die, you don't want a loved one to die, you don't want to catch COVID, you don't want to die of COVID alone in the hospital with only healthcare workers around you. When they understand that, then compliance is easier. And so for us, it's kind of strange to read the headlines in not only America that they're losing their individual rights are being violated because they're being asked to wear a mask. And also in England, sometimes I've been, as I said, I follow the Guardian and the Daily Mirror, and I see the headlines about, about mask wearing, not mask wearing. And we're like, why can't they just get their act together and say everybody has to wear a mask? In the Philippines, in Manila now, everywhere you go, you have to have both a mask and a face shield, which is a facial covering. They manufacture them very cheaply, where there's a shield, plastic shield, and then something that just hooks it to your ears like a pair of glasses, and you wear that, and then you have your mask underneath, and everybody goes out with it. You can't go into public areas without it. And you would have either security guards, meaning, each establishment has security personnel. If you go into a mall or a grocery store or market, then definitely there's some personnel as well there who will call you out. They won't let you in. And there's signs everywhere: no mask, no entry; no mask, no face shield, no entry. And then everywhere there are these, alcohol dispenser stations, either the automatic ones, or the guy will literally spray your hand.
Wow.
And then they have contact tracing. You have to either you take a photo with your phone, a QR code, and then you fill it in before you go in, or you have to write it on one of those, the handwritten jotter, where you put your name, your address, your contact number, and then the time that you were there. So you got to log in. And, it's
Tish,
tedious.
Do you think that the widespread adoption of PPE, like masks and face visors and things like contact tracing, has been perhaps easier in Southeast Asia than in Western Europe and the US, because you've been perhaps more exposed and to respiratory viruses with SARS and and other recent outbreaks? Do you think that's made, in a sense, that easier to for
oh,
absolutely,
absolutely. Yes, because somebody, like, for example, Hong Kong had a really bad outbreak. I lived in Hong Kong for a while, and Hong Kong had really bad COVID, SARS-CoV, and also MERS-CoV. We had a little bit of MERS-CoV because we had a lot of Middle East workers coming back, Jews back, and they had the same sort of, everybody has to wear a mask. And so I think in Southeast Asia in general, Japanese, Korean, South Asia, and Southeast Asia, ourselves, Singapore, everybody in Asia and South Asia mandated mask wearing very early on, and it was a general trend. And I think compliance is a little different because of our cultural. I think it's a cultural thing where you follow a leader. You don't tend to assert individual rights. I don't know if it has something to do with having been colonized by different countries for such a long time before. I mean, most of the Southeast Asian countries have been colonized in the past. We were colonized for a very long time by the Spanish, 300 years. We also colonized us for a little bit. And then we had the Americans, of course. And so I'm not sure if that's built into our psyches, but we tend to follow mandates from the government a little bit more, a little better.
Yes, it's very interesting observation, I think, Tish. And certainly in the US and the UK, we are definitely on the liberal end of the political spectrum. And I think people, this notion of freedom of speech, individual rights, and perhaps a shrinking of the state is very, very prominent. And that perhaps does make it harder for population level public health measures to be implemented when you don't have the adherence of your populace, because they're all thinking, well, what about my rights? These masks are don't let me breathe, I should, it's my body, it's my choice. There's all that kind of rhetoric that's coming, and I mean, rightly or wrongly, it does create difficulties, I think, from a public
that's
health
why
perspective.
it's very hard for us to understand, because given you guys are much luckier, you have a national health service, you have much more resources, your countries are much richer than we are. So for us, if we don't have compliance, then we would be in deep trouble. That's why it's being hammered every messages. Really, the messaging is so important that what's more important. So the last one was, there was a couple of messages. The last one was, okay, Christmas, no Christmas this year, to make sure that you're all at Christmas next year, something like that. Because Christmas is a big deal. 90% of the country is Catholic. We're the largest Roman Catholic population outside Rome or outside Italy. It's a big deal. And tonight, the 16th, is when we start our Christmas novena, where you start from the 16th and you end on the 24th, and everybody goes to mass. It used to be midnight, and you go every night for 9 nights, and it's like a what they call like something that you promise to do, because you're either giving thanks or asking something from God, and this is how you're going to you do your share, and you pray that God answers your prayers. And so the novena, which is part of the Christmas ritual, the 16th is when it's starting. People would flock to churches in the early morning, and we do this. There was a midnight one, and then there's one at 5 o'clock in the morning. People would get out of bed to do this, and it's part of the national ritual, the Philippine Christmas ritual, and that's banned. We're not allowed to have more than 30 people in a church at any one time. And can you imagine? So what we're doing now is we're doing it online. My mom is actually going to stay up and go to church tonight at midnight. But part of it is being at the church and greeting other churchgoers and stuff. But we can't have that this year. So we have to go online and get it done, and people do that now. So everyone's going to church online, and we're going to do our Philippine Christmas online, going to the masses. So that's how badly we've been affected.
And Tish, in terms of different families meeting up geographically over Christmas, is that permitted in the Philippines? Is there any relaxation of lockdown measures during the holiday period, or is
there's none. Actually, they've been going on television to let us know that you're not supposed to have more than two. Like, for example, my family is a family of 11. Okay, so that's my nuclear family. Those are my parents, my brother, my brother, my sister, their spouses, and the grandchildren, which is only 4. So we're actually only 11. But they said 10 people without exceeding your household, and only one other household. So for us, my brother lives next door, and so my household and his household have been mingling ever since the beginning of the lockdown, because we share the same sort of house. I mean, they're right next door, and the children are in and out. My brother comes in every day. There's a gate that separates. There's a backyard that we share, kind of. So we consider ourselves one household. And then my sister, who lives about 5 kilometers away, which is about 10 miles, 5 kilometers, she comes in once a week, and she has dinner with us on Sundays. And there's only 3 of them that come in. So what happens in the house is we have a fairly big one. So we have different tables. So they actually sit at a different table from us. And then there's a buffet where they pick up their food. And then we're in a different table. And then the next door neighbors are in a different table. So even if, so that's the maximum that you can have. We have 1 extra person.
Yeah.
But because, that my brother has 3 children. So we just say, no one's really checking. But really, you're not allowed to have more than that. And so the other night we had a Christmas party online. And that's how we've been doing Christmas parties and meetups with friends.
Christmas,
all of it
but
is
not
on.
As you know it.
No, not as we know it. Yes. Definitely not. No.
Yeah. And tell us, Tish, about the vaccine in Philippines. What is there a plan for vaccine rollout? What does that look like in the Philippines?
They're waiting on. I don't know. I think we're purchasing. I think the Chinese, I'm not sure if it's a Chinese vaccine. I'm not very happy about that, actually. I would rather get the Moderna vaccine because of the storage and also, of course, the efficacy. I'm not sure what the government plans to buy, but there is a plan, and I think they've pre-ordered a vaccine from China. I'm not so sure about that. Um, and of course, we have vaccinations for polio, for TB. TB is mandated, so when you're born, you get a TB vaccine. There's polio, DPB, all the childhood vaccinations. Hepatitis is recommended, but not necessarily everybody. But most of the people in privately get the vaccines from their own pediatricians. So the mandated vaccines are the MMR, DPT, polio, TB. So vaccinations are pretty good in the Philippines. Most of the children, as long as they're children, were vaccinated either in their government health centers or health centers in their community or in schools. So everybody gets vaccinated. But this vaccine, I don't know how it's going to be rolled out, honestly. First of all, the resources to pay, I'm not sure if it's going to be paid for by the government or by industry and, NGOs, non-governmental organizations, corporations. We have many, many large corporations that have donated lots and lots and lots of money already to help the government, and they've been really, really good. There's this one corporation called San Miguel who ordered a lot of PPEs, flew in all sorts of things from all over the world, and then distributed it for free. My hospital got an allocation from San Miguel, and they just listed all hospitals, and then they sent stuff. And so we have those really, really well-meaning and very generous non-governmental organizations who have been supporting and supplying PPEs and all that to everyone. But the vaccine's a different story. It probably will need to be a combination of government money, personal resources, as well as subsidy by corporations, non-government corporations, big
Yeah.
big industry. There are also, what do you call, big, for example, they have this Ayala group, San Miguel group, the SM group. So they have these, people in the top, billionaire who have a lot of business and real estate and making a lot of money. They're actually leading. And I have to say, I couldn't be happier that they've really stepped up, and they've been really, giving a lot of money. And San Miguel has a testing center. They actually put up a testing facility in different areas in the Philippines. So they set up testing centers, and they're subsidizing the cost of the test, and they're also doing it in their own facilities. They hired med techs and stuff. So it's a combination of factors, because the government, it's not going to be able to take care of it all. So you really need the cooperation of so many groups to get it done.
It's a very wicked, complex problem, how to roll out a vaccine. So some plans afoot in the Philippines, but no concrete ones as yet.
Did you know the first person who got the injection in the UK was injected by a Filipino nurse?
Yes, I think I did know that. Yeah. Yes. Yeah.
It was a Filipino nurse who gave the first vaccine out.
Yes.
So there we have a connection already.
Yeah. Well, as you said before, the Filipino health workers continue to make a huge contribution to the NHS. Really valued part of that. I'm just interested, Tish, about some of your clinical experience with treating patients with COVID, and certainly in your work as an internist and endocrinologist, you've seen patients. Some of your patients have had COVID. Can you just give us a sense of what that's been like on a kind of patient basis, an individual basis?
Yeah, one of the first persons that I saw, actually, I've had 3 patients. I've lost 3 patients with COVID, but I've also had successful COVID recovery patients. One of the most important patients that I had was actually an aunt of mine, auntie, family friend who was 87, was in the hospital for 5 weeks. And so every single day, she's diabetic. She's also on hemodialysis, and she developed COVID. And I actually had to be quarantined early on because of my first exposure to someone with COVID. We didn't know he had COVID. His symptoms, he was a 68 or 68-year-old man who came in complaining of vomiting and abdominal discomfort. And I saw him. We weren't really wearing masks regularly. I was think I was wearing a surgical mask, but I wasn't wearing higher protection mask. And he didn't have a mask on, and his son didn't have a mask on. And we had gone in, and he was in hospital only for 2 days. And he said, I've been vomiting, my tummy hurts a bit. And we gave him PPIs. We did a bit of workup, tried to work him up we were considering doing an endoscopy, but it wasn't done because he actually improved very quickly from his symptoms. We thought it might be just a regular, run of the mill gastritis, etc. And then he went home. 3 days later, 4 days later, he comes back with high grade fever. And then the x-ray that was initially normal is less than a week ago had now pneumonia. When we did the HRCT, then he did a swab, and then suddenly within 3 days he had passed away. And I had to be quarantined because of my exposure to him, as well as the residents who were taking care of him. And I was also swabbed and quarantined. So because the awareness wasn't there yet. This was very, very early in March, so first week or so of March. So he was my first mortality. So I've been seeing COVID patients primarily because diabetes is a very high risk disease. And so it's high risk for COVID. They're mostly elderly also. And then because of the protocol, which now includes dexamethasone for 10 days, patients were getting either diabetic ketoacidosis or very, very high blood sugar levels, which needed insulin treatment. So we were being called in for that reason. And so I was going into the COVID ward to manage the blood sugars of patients who have, me and along with other colleagues, one of my other colleagues declined to see patients, and she's younger than me, and she decided that for her own health and safety, she decided not to go because she also has children, so she didn't go. And so there were only entire time there were only 2 of us out of 5 who were really willing to go into the ward. So I would suit up every day, and then we wear the full PPE, and then you'd be going in and seeing the patients. And so for me, it was traumatic because you could see them all alone. And the first person who passed away, I was only in touch with his family through telephone. His son actually also was positive, and he was isolated and quarantined in the community. There's an alert when you become positive. What happens is there's a community alert. And there's also a barangay alert, meaning the place where you live is told. And so they're supposed to ensure that you stick to your quarantine. And so they kind of put a cordon around your house. It's kind of stigma. There's a bit of a stigma actually associated with that, is they are not allowed to leave the house. And then there's somebody responsible for, if you don't have a family member that can go out and do it for you, then somebody from the community is in charge of providing you supplies. If you need it, they'd leave it outside your gate, and then you pick up stuff like that. So it was quite traumatic because his son had COVID, and he wasn't able to. Even his father, there's an immediate cremation because Filipinos don't necessarily become cremated. We're Roman Catholics. We like to be buried in the ground with all the rites and services, and so it was a big deal to receive father in cremated. It's health mandated. It's public health. Whether you like it or not, you will have to be cremated. So that's how they received their parent in a cremated state, and that was heartbreaking. And I had to call them and let them know that their dad was in extreme measures, and they decided not to DNR, no resuscitation. And so when he passed, I called and let them know. Well, the hospital has protocols for release to funeral parlor. Funeral parlor comes, picks up, and then they cremate, and then family member has to go and pick up. Somebody has to go and pick up. And so that was one of the things that is hard. I think that was really hard for people who have lost family members, because not only because you can't be with them, we're very strict about not letting people in, even if they're dying. I understand that in other countries they allow people to PPE up and go in, but for us it's strict. So only healthcare people can go in. We do use those video, there's a video call or something like that, but that's about it. And then the hard part, of course, is not being able to mourn together, because we don't have just 1 day viewing. We have 3 day viewing. People are there 24 hours. Um, and then it's like the funeral is not just one occasion and one viewing. It's like 24/7. So people will drop in all at all hours, and then you would have, on the last day, the day before the burial, you would have a huge sort of, I wouldn't say party, but you would have a lot of people in, and people would come to support, and they'd stay for the mass and everything. So it's really hard because they now they limited. Now we have online burial actually, where you actually watch a funeral mass online. You attend someone's funeral online, and so it's just the hardest part, I think, was because Filipinos are so very social, and we have so many of these rituals which surround rites for burial and marriage, and because of the Catholicism, and to have that restricted severely is very difficult. And I think that's the
Yeah.
hard part for everybody, is they're not able to mourn properly
Yeah, that
as
must
they
be
should.
very, very hard. Very, very hard. And
Mm.
just one final thing I'd just like to hear your perspective on, Tish, is about the Philippines, your position on the globe in the Western Pacific. You're part of the Pacific Ring of Fire. You're very exposed to
Mm.
typhoons, earthquakes,
Oh
national,
yeah,
natural
absolutely.
disasters. Have you thought about what might happen if you experience the awful double whammy of a pandemic plus a natural disaster like an earthquake? So you've got more than one area of pressure
Yeah.
being applied on your health system. How do you think would you be well placed to
Oh,
respond to that?
okay. So guess what? We had an earthquake earlier today, 6.1 on 6.1 Richter in Mindanao, in the most southernest most island in the Philippines. We had an earthquake today, and about 2 or 3 weeks ago, we had two sets of typhoons come through. One was it was supposed to be a really strong one, but it didn't hit Manila. And then the second one that was supposed to be less strong hit Padway because we had massive flooding. So we have something like 26 or more typhoons coming through during the year in the Philippines. And so for us, and because they now can predict typhoons coming in, way ahead of time, that there's going to be a typhoon. So we're really, we're used to this. Oh, there's another typhoon. All right. And so, lockdown for the boats, no Coast Guard, no inter-island ferries, no fishing, no whatever. So they locked us down. Then evacuation is pretty good now. They do know how to evacuate very quickly, so to minimize loss of life. Of course, there's some things that you can't foresee, like the landslides and the massing. So that's pretty hard. We've had, you've heard about our typhoons, Haiyan, and all those those guys that have come through. So we have massive relief efforts. We have our departments of, the departments that take care of relief efforts, Red Cross, all of that. So in terms of disaster relief, we don't have a lot of um, resources, in the sense we have those really fancy, like equipment that if, for example, there was an earthquake and then you had to look for people in, we use like literally shovels and picks, and then we have crews coming in from other countries who send people to help, with ultrasonic, those kind of things. So we've had people do that. But for typhoons, for the most part, it's mostly people on the ground. The barangays would have their own, what do you call it, inflatable rafts. People would own their own. If they're typhoon prone, they usually own their own little catamarans that they build their house in such a way. When my father was growing up, they had a house on kind of not stilts in a way, but it was an elevated house because they lived in an area in about 60 kilometers north of Manila, from a place 60 kilometers north of Manila, where they speak a dialect that I don't understand. Okay, it's so different from 60 kilometers below. And he lived in a house that had a, most of the living is in the top floor, and so the ground floor is where they keep their. So the boat, the catamaran is tied on a post to a post in the house, and as the water rises, the catamaran rises. So they're and then they have a very, very tall set of steps, bamboo or wooden steps, and then all they need to do is step out of their front door into the catamaran. It's because they have one, and they know that they tend to flood, and so that's how they take care of themselves during the rainy or flooding season. So we've actually done, many of us know because we've lived, it's every year. It just happens every year. So typhoon comes through. And I think that in terms,
Tish, how do you think, if you were to get another Haiyan in the context of a COVID pandemic, do you think that would be enough to overwhelm the health system, or do you think that actually the processes and the resilience is in place from your previous experience of those events that you?
So we had the pandemic. We had a bad typhoon come through twice already. One hit the middle of the country really badly, Bicol region and everything. So the middle of the country was badly hit. Resources were made available. And then, again, as I said earlier, we had an earthquake today. From all accounts, there's no injuries or deaths. And so, the other thing is, I think because it happens so often, our buildings there's a very strict code for when you build a structure, that it has to be resilient to a certain degree of, tremor. So the most extreme earthquake that we had was, I think, nearly 8 or 8.2 or something like that. And even when that happened, we had, there was some damage in the main areas, but most of the time, we're lucky that it doesn't become hundreds and hundreds of people dying. So I think because of all the years of having to deal with this on a regular basis, as you say, resilience and also community helpfulness. There's a term in Filipino called bayanihan. And bayan is country, and it's kind of like the attitude of helping, extending yourself to your fellow countrymen. It's a national trait. It's a spirit of so whenever you see TV coverage of a disaster in the Philippines, you think there was nothing going on because people are smiling, people are waving at the camera, they're in floodwater, but they're still waving at the camera. They still manage to smile and make a joke. So I don't know if it's a trait, but I think the resilience of my countrymen toward these kind of things is really, really, over the years has been built up. And so in a way, it's a thing that is adaptable and we can manage in many situations. And I think one of the saving graces is that we find humor in almost any situation. And so I think that's pretty much something that's developed over the years.
Yeah, I think that's a really positive note to finish on. Well, thank you very much for your time chatting to us today, Tish. But in terms of what I've taken away from this, I think there's more similarities than there are differences in your experience of this pandemic. You've talked in broad terms about just all the different facets of society, about your experience of lockdown, what it's been like working in a hospital setting, and mask wearing and the vaccine and seeing relatives over Christmas. We've covered all the kind of same areas, the things that we're discussing in the UK at the moment, and it's just great to hear your perspective. So thank you so much for your time today.
You're very welcome, Will. It's a pleasure and an honor to join you, and I hope that we will all pray for one another. One of the things in the Philippines is that there's a novena. It's a time when everyone stops and says a little prayer, and that usually happens at 3:00 in the afternoon. And people have been doing this since the pandemic began. And there's a special Orasio Imperator, which is coming from I know that and everybody stops and says that prayer every day. And so I think that also being prayerful. I know it's not a big deal in many countries, but for the Filipino, prayerfulness is also a very important way to keep sane and also keep your head on the ground and be hopeful. I think that's part of the reason. And so at 3 o'clock every day, we pray for everybody across the world, not only our families, but everyone in the entire world, that everybody will survive this and that we will all get through together. It's a humankind thing. It's everybody in the world. And that's why sometimes, it's really sad that this is happening, but we have to we have to ask ourselves, is there a question? Is there something we need to learn? Have we been abusing our environment and taking so much for granted for so long? I mean, just believe that, in biblical terms, plagues and stuff don't happen, for a reason. I always believe everything happens for a reason. So maybe there's something that humankind needs to go back to. Remember where they started back, and the pollution getting better, and the things that we used to see in the skies and everything. Even the pollution in Manila has improved tremendously. So I think that we just, maybe this is God's way of reminding us that we need to do better by our planet and by each other. In
Yes.
general terms, yeah,
Yeah.
everyone is experiencing this, and I hope that each of us and each of our countries, uh, really take it to heart that it's not a political thing. Illness and this pandemic shouldn't be made a political tool. It's the bottom line is it's somebody's health that's at peril, and whatever needs to be done to be able to ensure that we minimize everyone's risk and we don't transmit the disease to other people, that's just being responsible and just being, a proper human being, right?
Well,
So I hope that
yeah.
everyone gets that message and everybody understands that each of us has personal responsibility toward our fellow human being to be able to take care of one another.
Well, thank you for your prayers, Tish. And it's very reassuring to know that we're all in this together as a global
Yes,
community.
absolutely.
Yes, and also there's a lot we can learn and take away from this pandemic and grow, and it's reminded of us of all the liberties that we previously took for granted. So it's nice to finish on a positive note.
Yes.
And for those of you tuning in, what has your experience of this pandemic been like as a clinician in the corner of the world that you're in? Have you been practicing extreme medicine on your doorstep? If you'd like to feature in an episode of this podcast, please contact us by email at admin@extreme-medicine.com. We'd love to hear from you. Look forward to seeing you on the next episode. Bye for now.